Put us all on mute and let everyone in. Have a fantastic session tonight. Hello, everyone, and welcome to today's virtual interactive panel discussion brought to you by Healthcare Leaders of New York. My name is Tia, and I will be serving as your ACHE technical host for today. I am so glad you were able to join us. Before we get started, I would like to go over a few items to help you navigate the program in our virtual environment. For the purposes of noise control, your lines will be muted for the duration of the session. The chat function will be available to you throughout the entire event. We encourage you to share your comments and questions in that chat box. This event is being recorded and will be available for viewing in ACHE's Learning Management System in approximately 2 business days. Today's session is worth 1.5 hours of ACHE Virtual Interactive Education credit. To earn this credit, you must be logged in for the entire 90 minutes of this event. All attendees who meet this requirement will have their 1.5 Virtual Interactive Education credit applied within 2 weeks from today's event. We do encourage you to complete the evaluation for this event. I'm going to be dropping the link in the chat box shortly, and then I will reshare it before we close out today's session. Now to begin, let me turn it over to Carl Marie.
Good evening, everyone. On behalf of the entire HNY board, welcome to our Digital Health and Healthcare Delivery System program. My name is Carl Marie Memnon, and I'm the 2024 President of Healthcare Leaders of New York. Healthcare Leaders of New York is the local chapter of the American College of Healthcare Executives, representing over 49,000 members. Within ACHE, there are 8,600 fellows with board certification in healthcare management. At the local level, HNY represents over 1,900 professionals in the New York metropolitan area, providing access to networking, education, mentoring, and career development. Our mission is to advance healthcare leadership and management excellence through professional enrichment and continuing education of our members. Next slide, please. The intersection of healthcare and digital technology is here to stay. In the rapidly growing field of artificial intelligence, advances towards more personalized medicine, and so much more. This evening, we will hear from executives representing various institutions as we continue to evolve in this ever-changing healthcare landscape, which is becoming more digital. Our moderator for this program is Chief Umeje. Chief is a seasoned IT professional and with extensive experience in digital technology, clinical IT, and leading large-scale projects. Currently serving as the System Vice President of Laboratory Operations and Information Technology at New York Presbyterian. Chief has been instrumental in driving numerous initiatives aimed at enhancing patient care and operational efficiency. With over a decade of experience at New York Presbyterian, Chief has overseen the execution of several digital initiatives, notably among these were the implementation of Epic for New York Presbyterian, Weill Cornell Medicine, and Columbia. His leadership was pivotal in the successful launch of the state-of-the-art David H. Koch Center, where he directed IT initiatives to ensure seamless integration of advanced technologies. Chief is committed to improving patient outcomes, is evident in his role in launching the iReferral SM, automated donor referral technology, which aims to increase organ donation and transplantation across New York City. His strategic vision and ability to manage complex projects have made him a key figure in the healthcare landscape. Chief holds dual degrees in philosophy and information systems from Baruch College and a Master's of Science degree in Health Informatics from SUNY Downstate Medical Center. Now, without further ado, I'll turn it over to Chief. Chief?
Good evening, everyone, and thank you, Marie, for the sweeping introduction. In hindsight, I should have made that a little bit shorter. So we'll make a note for that for next time. For all the folks that have joined, welcome to the panel. You will notice with me esteemed panelists that have a diverse background. I will have Geeta Nastasi, who is this current CNIO at Northwell Health. We have Nasser Nizami, who is the Chief Information Officer at Exact Sciences, and Dr. Matthew Shafirov, who is the CMIO at White Plains Hospital. What I would like to do is, because I could not do justice to all their legendary credentials, is to go through each one of the panelists to spend a few minutes talking about their backgrounds and perhaps tying their backgrounds more to this topic. I'll start with Geeta, if you don't mind getting us started.
Thank you, Chief, and it's a pleasure to be here this evening. As Chief mentioned, my name is Geeta Nastasi. I'm the Vice President and the Chief Nursing Information Officer at Northwell Health. For those of you who are not familiar with Northwell, we are the largest healthcare provider and the private employer in the state of New York, with over 21 hospitals and about 900 outpatient facilities and about 80,000 professionals. And next year, we hope to open the first Northwell High School of Health Sciences. So my background is in clinical nursing, IT, and informatics, and I've been at Northwell for just over a year now. And this is such a timely topic because every day somebody is coming with a new AI venture, or there are hundreds of vendors knocking on our doors saying, can we come in and show you what we're doing with digital health services? So happy to be here this afternoon. I'll pass it back to you, Chief.
Thank you for that, Geeta. Dr. Shafirov.
Yes, certainly. Thank you, Chief, and thank you, Maria, for the invitation to join today. My name is Matthew Shafirov. I'm a dual board certified physician, board certified in emergency medicine with 20 years of practice, and board certified in clinical informatics, having been over a decade and a half in the field. Fortunate enough to both practice clinically while being full-time in CMIO at White Plains Hospital. For those of you who are not familiar with White Plains Hospital, we're a 299-bed facility in White Plains, New York. We are part of the Montefiore Health System. We have a large and expanding footprint, burgeoning on tertiary care facility while still maintaining the tightness of a community hospital dedicated to our community and providing them services close to home.
All right. Thank you, Matthew. Nassar?
Thank you, Chief. And thank you for inviting me to this panel. Looking forward to this discussion. My name is Nasser Nizami. I'm the Chief Information Officer at Exact Sciences, which is a company in molecular diagnostics specializing in cancer research. Diagnostic tools, screening tools for early detection, prevention, and treatment of cancer. Prior to Exact Sciences, my entire career has been in healthcare systems. I was the Chief Information Officer at Jefferson Health and Thomas Jefferson University in Philadelphia. And prior to that, I had the pleasure of working with Chief and Geeta at New York Presbyterian. So my time in life sciences at Exact Sciences is 1 year. Learned quite a bit, and looking forward to share some of the learnings with you.
All right. Thank you, folks, for those introductions. Now you know your panelists. I think we should throw out a poll to figure out who's our audience and kind of get a sense for the spread of our audience. Show me if you could put it up there. Okay, so we can see the results of the poll there. We've got 42% administration. This is definitely administration heavy this time, and operations and a few clinical folks, which is quite helpful. So now to the main event. Everyone's heard or uses the word digital. Many use it loosely. And I know that the term digital health means different things to different folks. What I would like to do is kind of go through the panelists and have a sense from their different backgrounds and from their vantage points, how they see digital health and what digital means to them. Maybe Nasa, I'll start with you on that topic.
Sure. So, look, I agree. First of all, digital and digital health have different meaning to different people. To me, it represents intersection of healthcare and technology, transforming how care is delivered and managed. It's about leveraging technology, tools like telemedicine, mobile health applications, wearable devices, and of course, AI-driven diagnostics to enhance patient outcomes, improve operational efficiency, and ultimately empower individuals. And I think it has a slightly different meaning for healthcare systems and patients, or at least I should say the benefits enablement. For instance, in healthcare system, I think it's more about being proactive rather than reactive, focusing on prevention. Things like remote monitoring, personalized care comes to mind. It is less about technology. I think it's more about using data to drive decisions, to streamline processes, and ultimately improve patient outcomes. From a patient point of view, it's about access, it's about convenience, and it's about empowerment.
Very, very good point. And since we started off from the patient's point of view, Matthew, if you could give a sense as a physician and an emergency room and in a community sense, how you see digital health.
Thank you. So, yeah, as the years have gone on, digital health has really just become healthcare. I mean, the combination of electronically referenced and stored data within a health system, be it within an EMR, a PAC system, or any of the other ancillaries which touch the main record are essentially healthcare. We are embedded into the nuts and bolts of care within a facility, no different than you rely upon electricity for power to manage your facilities and run all of the things that go on it. Data is the lifeblood of care. It's just now provided through an interface that is using the term digital instead of on a piece of paper. So in many ways, I don't really differentiate between true healthcare and digital health. We can say that digital health is the utilization of technology to provide healthcare through different interfaces and modalities than perhaps previously utilized in the past. But to me, I look at digital health as it's just healthcare now. It's how we do things. We utilize these tools and techniques to expand our access for patients, or to utilize different techniques to reformat a series of images, or to expand care into the community through telehealth, or as I'm sure we will spend plenty of time today talking about, artificial intelligence, or the use of data to generate new decision points and new ways of solving the problems that patients face today.
Got you. Thanks for that perspective. So I think the buzzword with what you've said is it's just healthcare, right? Effectively, that's the punchline. Geeta, I know you have a unique perspective from a nursing, which is typically a high touch profession. Could you kind of walk us through how technology is helping, or how digital is helping nursing care?
Nurses tend to spend a lot of their time in the EMR, and you just want to get through your shift, and you want to stay there and not look in a lot of different places for information to truly inform taking care of that patient. And I think that's one of the biggest challenges right now, because I think there's a lot of digital technologies that are out there that are being introduced in pilots or different phases, and nurses touch many of those. While many of us are going to sort of this sort of standardized EMR, like getting onto one EMR system, etc., there are still so many touch points. So I would say that right now we're at that inflection point where we're slowly going towards a more connected, streamlined experience. And we need to be very, very careful about that, because if we have too many hops taking care of a patient, it is reflected in the patient experience, and it does contribute to clinical burnout. But focusing on the positive, I really believe that the use of digital technologies will, in the very short term, truly enhance healthcare delivery at a larger scale, and clinicians, as a result, does improve patient outcomes and facilitate the management of health and wellness, and well-being needs to be a crucial part of that. And as we progress through the conversation, I am really happy to give specific topics on the way we've actually implemented it that has actually touched nurses.
Well, thank you for that perspective. One thing that's evident is digital, well, like you've all alluded to, could be seen as ubiquitous, and it's part of care, both from those providing care point of view and those consuming care point of view. Let's focus a little bit on those providing care for a second, and then we'll pivot into those receiving care. What would you say, and maybe Matthew, I'll start with you, what would you say are some of the biggest pain points you're seeing in
sorry.
digital technologies for those providing care?
No, I didn't know what this is.
And if you're not speaking, if you don't mind going on mute, thank you.
Great.
All right, Matthew, go for it.
Yeah, so for those of us providing care, I mean, the greatest challenge with digital health, I think we've already heard Geeta mention it, is that there are so many inflection points or different places where data is collected, stored, retained, presented to individuals in ways that are seemingly at times challenging to present to a clinician looking to solve a specific problem for an individual patient. Right. And in many ways, this is because healthcare we're not making widgets. We are taking care of individuals who all are uniquely different and can present in various different fashions, what we would call variably variable. So that makes it hard to present a standardized system tool that can be used in all of these different ways by individuals who both have different ways of collecting, consuming, and interpreting data. So as we're all somewhat different learners, we all consume information slightly differently. So to take a standardized tool, like an EMR, and trying to create an interface that accounts for the different styles of each physician in their understanding and interpreting data, I think is one of the greatest challenges that we have from a clinical perspective. Clearly, the flip side of that coin is that data is available. It's available often in droves, sometimes not enough of it, as fortunate enough to also be a member of on the board of the New York eHealth Collaborative, and have spent the last 6 years working with that organization, trying to move data around. I think still one of our biggest pain points, but the ubiquity of data, the amount of it available at the fingertips, organized by and seen by multiple people at the same time. If you compare that to our paper world 25 plus years ago, if you ever had to trudge down to medical records room and find the chart, only to find that it's been signed out and can't be found, you can appreciate how far we've come on the digital world.
Gotcha. Thank you for that. Geeta, on the care provision side, what are some of the challenges you're seeing from your profession and any vantage point that you choose to take?
You know, I think we live in this sort of age where we have so many different generations in the workforce at the same time, and they're all at different stages of their evolution. And I think with the inflection point we are right now with digital transformation, I think some people just haven't caught up. And that can be a blessing and, in disguise as well, because we sort of get to shape them and train them in the way we need to. But I feel as though with the generation that's about to move out of healthcare, it sometimes is a lot more training needs that you have to be aware of, and everybody learns at a different pace. And consequence of that, on the opposite end of the spectrum, you have the digital natives that are now coming into the healthcare, and their physical and their digital worlds are quite seamless, and they expect that level of high touch technology. And to them, that's a great satisfier. So trying to blend all of that in a workforce that's very diverse, to me, it's a great challenge with training. And I really feel as though we're moving to this point where very quickly, I would say maybe put my neck out here, in the next 5 years, we're going to have a lot more human machine interface. We're going to have a lot more prompting, and we're going to have this whole concept that Gartner really recently spoke about the augmented connected worker, where we're not replacing the compassionate touch and the care, but we're certainly going to have partnership, if you will, with machines and prompting. And it's something that is difficult for a lot of people to accept, that, they're no longer maybe the captain of the ship, or we're doing more virtual than we do traditional in person. That's a huge culture change right there. So to me, that's the second one. The other one, obviously, is technology adoption. And that ties right into what I just said. But then on the patient side, I also see it as privacy concerns. And there is just so much of that as we're rolling out technology. So, infrastructure is old. You have a 4-bedded patient room. It's hard to put something in there with a speaker so you can talk virtually to your clinician and your care team. It might work in a single-bedded or a double-bedded room, but it's a lot more difficult. And then I'm sure we'll get to the cybersecurity risks somewhere down the line.
Yeah, thank you for that, Geeta. And Nasser, as a CIO, both in industry and of different health systems, I am sure that when the clinicians have problems, your phone is going off the hook. So you might probably have the biggest list of things to talk about from that perspective. Could you share some of the problems with implementing these technologies and the adoption from the users you serve?
Great. And look, Matt and Geeta covered it very well. And I love Geeta's use of partnering with technology. Like, instead of thinking of technology as a tool, think of technology as a partner. And with AI, I think that sense is going to only increase. Look, I think in terms of pain points and what I've seen, I think number one probably is interoperability. So, fragmented system, lack of standardization. And often as healthcare professionals, especially in healthcare system, we think about interoperability among healthcare systems only, which is a big issue because that's typically when patient records are exchanged and so forth. Coming to life sciences, what I realized is there is zero or very little communication between life sciences companies and healthcare systems. Like, there is a huge amount of data, whether it's medication data, whether it's diagnostic data, that are basically held perhaps in silos. I also think that we don't realize that this issue, or we're ignoring a huge area of in terms of data in systems, in wellness apps, in variables and so forth. So I think the interoperability issue in a nutshell is much bigger than I think we realize. Geeta touched on data privacy and security. That continues to be an issue. Just this year, if you look at cybersecurity incidents, some very, very large incidents that, without naming any names, we all can think about just this year. I think digital literacy is also an issue. I think Geeta touched on physician side, but on the patient side, it's not even. It's very uneven. And it's something that as healthcare provider systems, we just have to think about. Reimbursement models when it comes to digital healthcare comes to mind. It's again, even with telemedicine, for example, one of the reasons that telemedicine was slow and still is slow to adopt is because reimbursement models are often not clear. And again, we'll talk more about this, but with AI and I think things like bias and other ethical concerns, I think are going to we have not even started talking about it, and I think they'll become much bigger issues, not in a very distant future.
Yeah, and thank you for that. You kind of teed up the issue of financing, whether it be reimbursements for care or actually funding these technologies. I could assume that these are not cheap. I've seen numbers thrown out there. It takes about $1 billion to do big EMRs or multi-millions of dollars to do things like dictation. Maybe, Nasser, I'll stick with you first to kind of give a sense for what you've seen in terms of how these things are funded, and then making the value proposition to a CFO or to a board to grant funding for these technologies.
Look, so first of all, the cost of technology was already high and increasing at a very high pace. So, and historically, we have thought about EMR implementations and value prop. So my initial reaction to that, and I have been part of multiple organizations where I had to build the business case and make a point that there is an ROI. I would say that if we look at technologies like EMR as just technology, it's very hard to justify the ROI. The ROI really comes when you think about the holistic application of technology, the used by clinicians on the revenue side of things, on the operational efficiency side of things, improved quality, so on, automation. That's where true ROI comes to mind. In general, in my experience, it's not easy to convince the CFO, but it's doable. Now, the trend that I'm most worried about for the last maybe post-COVID, I would say, is that there has been a great deal of investment in startups in the last 3 or 4 years, like billions of dollars. And we have, at least in my opinion, not really seen the real benefit, especially when it comes to cost side of the equation, right? I mean, I think there are arguments, and it's hard to make it, whether it has improved quality or improved access, and etc. I mean, but cost in general, startups in technology have not demonstrated a reduction in cost, and that I think is a concern for me, especially looking at the amount of funding that some of the startups get and I wonder about how they're going to justify the return. I just don't see it there.
Chief, I can just add to that real quick. I mean, you talked about the cost of technology, but it's everything else just to get the technology inside your house, right? Because a lot of our infrastructure is really outdated, and you have to have like a certain level of Wi-Fi connectivity. You have to have some sort of infrastructure modernization. Maybe a lot of people are moving to the cloud. So there's different requirements that you need at a minimum to even launch a lot of this technology. Forget about the money, just to buy the technology. It's to get ready for it. And then it's to implement it. And then it's to train on it. So, and I think right now it's just so expensive. And it's so confusing out there. I mean, just in this country, the last time I was reading, a latest research showed that there was, just for consumers, over 350,000 healthcare apps. And I could tell you that not a day goes by that your inbox is not flooded with vendors coming in and trying to oversell their products. And it's changing so quickly. You have analysis paralysis. That's the other thing, because that with Moore's law in another 2 years, it's going to change again. And which direction should I go in? So I feel as though to sort of head all this off, we really need to be very, very clear about what our strategic roadmap is for digital, and like everybody needs to be aligned on it. Like what comes first and what comes second. There was a study done by McKinsey, I think it was last year, and they said like for health system executives, current investment priorities do not always align with areas they believe could have the most impact. And then there is alignment in some areas, including virtual health and digital front door. But they think that's those two areas comprise about 70% of where respondents think that we should go next with that digital front door and our virtual health.
Yeah, thanks, Gita.
Yeah.
Matthew, just real quick on that same topic, I want to maybe switch a little bit to the reimbursement angle, right? I've heard a little bit that providers may do more digital care, especially ambulatory care providers, if they could get paid for it. I know during COVID, there were a lot of exemptions made, and a lot of those rules have been pulled back. In your experience, what are you seeing or what are you hearing from your provider colleagues on reimbursements for, let's use telehealth as a proxy for digital health in this case?
Yeah, so certainly there was a lot of uncertainty when the federal government withdrew all of the COVID changes that allowed for telehealth payment on par with physical visits. I see a lot of work around the state level to ensure that reimbursement for digital health visits, telehealth visits remain comparable. But that said, there's, I don't think we really ever knew what the true balance between in-person and virtual visits was going to be. We went from a very low single-digit number of televisits, right, to an exceedingly high number, to a let's just get everybody back in the office number, to now somewhere where, if I recall directly, we're in line with like what most of New York State is, which is somewhere around like 10% of visits are virtual, excluding behavioral health, which is its own niche and probably will stay significantly above traditional medical visits. And of course, not every medical visit is applicable to be a telehealth visit. There's certainly certain types of follow-ups and other visits that are more on par for telehealth. I think what we see with some of the physicians is not just the reimbursement issue on telehealth that's a concern, but it's more almost along the lines of like, how do I structure my day? If I'm a busy primary care physician and I'm seeing upwards of 30 patients a day, that onboarding time onto the digital health platform, dealing with the logistical challenges can really throw your pace off. And so unless you're a clinician that is begun to carve out specific times of day or days of the week to perform digital health encounters, that task switching from an in-person visit and how you structure your visits to seeing somebody in the exam room, then back in the office, then the next patient in the exam room, to do all a telehealth visit can be somewhat challenging. And that's why I think we will likely stay even, regardless of whether telehealth encounters are always on par from a dollar sense as an inpatient visit, but for primary care or some specialty visits, I think just the logistics of the day will keep those numbers at a certain percentage for a long time that probably aren't going to move much more, in my mind, from the 10, 15, maybe 20% of your practice, depending upon what you do.
Got it. And I think that's a good segue for us to switch from those providing care to those receiving care. I think we should throw up the poll about which groups are more willing to share data with providers, and let's get a sense for what this group thinks. Interesting. And I'm being intentionally sarcastic because I thought the silent generation would be 100%. I think there's no shocker here that the Gen Zs, millennials will probably be the pick of the pack here. Now, when we think about the patient's perspective, maybe Matthew, I'll stick with you from the telehealth. Could you kind of share what your patients or what you hear patients are asking for from a digital point of view? What do they want?
Yeah, they want simplicity. They want completeness. I mean, many of them are getting a level of information that they haven't had before. I think the last few years, with the expansion of information sharing through the federal regulations regarding information blocking, have provided patients with an unparalleled access to at least their data collected in a healthcare setting provided to them. But I think what ultimately patients want, and if I put on my own patient hat, is I want all of my data available to me, and I want platforms in which I can integrate it to understand it across dimensions that are important to me. Right. So my healthcare data may be one thing, but if you're someone who collects personal data through a fitness tracker of any kind, be that your Apple Health Watch or other wearables, and you want to understand, how does my healthcare data impact my day-to-day data? Those interfaces don't quite exist today. So patients want to be able to take all their data, integrate it in some form or fashion that allows them to both understand it and make it applicable. And then the other thing I think that patients want about data, and this goes back to Nizar mentioned, is they want that data to be easily exchangeable, and that ecosystem really doesn't exist today, right? Either the expectation and what I see in the emergency department is patients just expecting their data, regardless of where it was collected, to just be available for me at my fingertips when I'm taking care of them, right? We see this a lot, not just EMR data, but we're seeing this more and more with DICOM imaging data, which is really even lagged behind EMR data for exchange. So that simple exchange of images, I think patients want that to be available for their physicians as well. So it's about exchanging data and then making use of the data from a patient perspective that you can then take and apply to your day-to-day life, so you can be, well, not just getting health care, but wellness care, really.
Got it. And Geeta, I'll ask a slightly different skew on the same question. From a patient, from a nursing inpatient perspective and these digital tools, do we find patient apathy or patient fear for using these tools with caregivers? What are you seeing in terms of how patients react to some of these digital technologies in clinical scenarios?
Well, first, I'd like to say that it's not just about the patient anymore, because we have a lot more of family involvement, and that's something that I've noticed in my years of being at the bedside. Is it was just the patient, but now you're really dealing with the entire family and significant others, and that's generational. And strangely enough, just using the example of virtual nursing, when we did our surveys and we sort of found out what the patient perception was, and that word perception is really important. In the 95th percentile, they were all very, very happy with it. And part of that is because of the overall experience. When you deal with somebody, say virtually, for instance, you're doing virtual nursing, and you're talking to a patient. You're not being interrupted. You're not being pulled in 50 million directions. You're focused. You're laser focused on that patient. You're giving them your individual attention. And I thought I didn't think I would see that, but I actually loved seeing that. But the other thing about the patient experience is that we now have to add this word digital into the patient experience. So it's almost like the digital patient experience also becomes really, really important, because we're throwing so much technology on our way to hopefully become smart systems, that we need to be smart systems, unfortunately. And a lot of people will say that technology did not drive care. And I don't think that's what's happening. I think people are really afraid that if they don't evolve and they don't implement technology, they're going to be left behind. Because at the end of the day, we're providing care, but we're also running a business, and we need money to keep operating and to keep moving forward. So as we do that, I think we have to be very, very careful about having a connected experience for our patients and their family members as well. When you go through the continuum of care and you approach us first, maybe in the community, and then in a physician practice, and then you might come into the ED, then you'll go to the inpatient stay, then maybe you're getting discharged home. That has to be a very fluid, hopefully seamless process, and we should be using a platform modular approach rather than having disparate endpoints, because it does impact the patient experience. And the thing to remember about patients now is they do have a voice. They're out there, they're on the internet, they're searching, and they want care that's fast and accessible and worth their while as well. So we have to always factor the generation in that. You see these things popping up all over the place now. People are shopping around for care. So, and they can go to somebody else. So you see organizations like, for instance, Northwell is thinking about the patient experience, not only in terms of technology, but what else can I make you feel like you're in a 5-star hotel? So we recently employed Michelin star chefs to treat food as powerful medicine. And it's so wonderful when you hear the stories about what a great meal can do. Even though the room might not be like a little dingy and may not, have maybe stains on the wall, but they have a great meal that they really enjoy, like they're in a 5-star restaurant, and makes all the difference. So I just wanted to throw that out there. It's about everything else just beyond the technology.
Got it. And Gita, now that you mentioned Michelin chefs, my belly's rumbling because I'm thinking I need some food therapy too. Nassar, a similar question, but a different skew here. We've heard patients want to use technology. We've heard that we can impact the patient experience through digital technologies. One of the things that it gets in front of everyone, if you kind of walk us through some of the complexities of where you're seeing the industry going, is we have all these tools, we have all this data. And as a patient, why is it that when I walk into my favorite healthcare system, my doctor doesn't have it? Yet they're spending all their time documenting and digitizing, and I fill out a form 50,000 times. Can you kind of walk us through some of those challenges technologically that are impacting that? Oh, you're on mute, sorry.
Oh, yep, sorry about that. So look, I don't have all the answers, but let me just highlight a few that I have observed. First of all, look, our health systems unfortunately work in silos, right? And some of these are intentional, some of these are unintentional. So things like multiple EMRs. So these are vendor issues, and vendors don't necessarily talk to each other in a way that we would like them to talk. So yes, the basic information, medication history, there are changes, like there are some health information exchanges have enabled some level of data exchange, but it's nearly not where it would like to be. So you think about, CT scan, X-rays, and so forth, right? None of that is available today. So, technology in itself and the nature of free market and a competitive market, I think one of the downside, unfortunately, is there are no incentives for vendors to create system beyond a certain baseline that government has mandated, right? That's really the baseline. Beyond that, they really don't. Actually, they're at times, unfortunately, it feels like the vendors are more motivated by not allowing other systems to talk. And same thing with in the health system side. And it could be unintentional policies of the health system that prohibit or just come in the way of exchanging data with others health systems. And people think of health system as one, entity. And look, for those of us who have worked in the health system, that's not the case. You think about lab, it's its almost own business. A cardiology, a cancer center almost runs as a business. In the type of technology, so the PACS, that system that is being used for imaging and radiology probably is not the same PACS that is being used in cardiology, right? So just the idea that health system, even within a health system, the data is harmonized, I think is not true. And I've seen it not to be true. It's very hard to do that. And then I think, as I mentioned earlier, and we have heard from Dr. Shafirov and Geeta, when you think about where is data being created, the next frontier, I don't think it's healthcare system. Healthcare systems data is going to be far less, or said another way, the data being created, wellness data being created by health apps, by wearables, by us answering the question and so forth, is way more. Like my Apple Watch collects data every second on me, right? And it's being stored somewhere. That data today is not available to my caregiver, right? And this is just one example, right? And there are so many other behavioral data, data points that other organizations are frankly collecting that we don't even know about. Amazon collecting, healthcare data, or Facebook collecting behavioral data, and so forth. So this is I think an area that by just talking about interoperability of healthcare record, legal medical healthcare record, we're still stuck there. We're still trying to figure that out. And I think that this world of data and healthcare data and digital data have moved far beyond where we are. And then again, being now that I'm working in life sciences, I'm interacting with other like pharma companies, diagnostic companies, is fascinating that life sciences companies frankly don't even talk to healthcare systems, like beyond some like basics. Like, hey, all right, you need that information, I'm going to give you that information. But the wealth of information that is today, in my opinion, locked in these silo systems is just amazing. And as a society, I think it's incumbent upon us to figure out a way to incentivize, to unlock this data. Because I think that in next few years, 5, 10, I don't know exactly when, but especially with the advances in AI, the opportunities are just amazing.
Well, thank you for that, Nasser. So you pulled on two topics, and I can toss a coin which way to go. We could go the AI route, or we could go on the value proposition of health disparities and public health. So I think I might lean towards health disparities and public health to start with first. I tossed a coin in my head, so that's how I got there. So let's pose this question, and maybe Geeta, I'll start with you. One of the value propositions of digital tools or technology-enabled healthcare from a consumer's point of view is I consume this data, I'm more informed about my healthcare, and hopefully I can make preventative decisions ahead of time. One of the values of us sharing, I think, across multiple systems is the notion that if we aggregate enough data, we should be able to treat public health crises different, and we should have enough data to do more. What I call it predictive research or preventative care could be advanced. What are you seeing about the promise of digital tools in public health, and in particular disparities?
I will give you the example of the World Health Organization. So last year they held a symposium where they had invited reporters from all over the world because they wanted to highlight the fact that the 17 Sustainable Development Goals of the World Health Organizations, that they feel every single one of them can be helped and advanced with digital technologies. So they actually had 51 robots, and they were showing how these robots could help. So if we use just one facet of digital technology, which is robotics and AI and large language models, and we just look at that, they had 9 humanoid robots and they were being interviewed. And they talked about that the future of the World Health Organization and meeting these goals, that robots are going to play a huge part in that. And then when you look at how globally they are actually using technology to help them. So some examples are that if we look at telehealth in Uganda, they're using that to promote medical consults to enhance healthcare access and reduce geographical barriers. They're using drones in Tanzania to spray mosquito sites with larvicides to reduce the incidence of malaria. Hospital in China are now using 5G technology to perform remote surgeries. So everywhere that we're looking at a global level, we're seeing that people are saying and they're thinking that digital health technologies will help advance. Now, there's always that thing about, well, will it make healthcare more accessible? The answer right now is everybody thinks yes. It will promote health equity and healthcare access, but we know that there are large deserts right here in America, and we look at that in people in rural areas who cannot afford technology. Right in our own hospitals, we have this thing that we call our BYOD strategy, right? Bring your own device. So like if you brought your own smartphone into the hospital, we can share information with you through your patient portal. But we know not everybody has a smartphone, not everybody has a cell phone. So I think we still have a lot of challenges. As much as we're trying to use technology, we still have a lot of challenges around healthcare equity in people who cannot afford access to devices. And we really need to focus on that for public health prevention. And I think that's the one big lesson that that the pandemic helped us with, which I feel is maybe one of the reasons why, despite the fact that we don't have a lot of reimbursement for telemedicine and for virtual care, I think Medicare does it, but Medicare does it. But I know a lot of commercial insurances across several states here in America, they don't even have a reimbursement plan for virtual care. I think we really need something like virtual care to reach these pockets of people that are in deserts that maybe cannot come to our facilities or don't have the resources to do that. So I think it's a double-edged sword right now.
And then Matthew, as a provider that gets to treat patients, are you really seeing the value of these technologies across divergent populations, or it's too soon to tell?
Yeah, for me, it's probably too soon to tell, although I would say that the near ubiquity of cell phones means that most individuals, you know, at least in our encapsulation area, which Westchester County is relatively diverse, have more computing power in their hands today, right, than all of us had as kids growing up. And the ability to, you know, what a cell phone in and of itself just offers, not just the ability to access healthcare data, but to research information, to store information, is really, I think, the ground level, maybe the foundational level. Certainly, lots of ways to go here to ensure that access to care is equitable across a larger population. But the ability to collect, store, see, communicate with healthcare providers through a cell phone is at least the starting point of that. We don't see a ton in clinical worlds. We certainly have lots of people that bring in data from other resources and like for us to interpret it or gather it or download it or integrate it in their medical chart. And that varies certainly by individual and in many ways in disease states, right? So we certainly see several disease states where people have a significant amount of data. If you think of individuals with diabetes that wear a glucometer, right, that's collecting data almost as frequently as perhaps your Apple Watch is collecting heartbeats. There are people who wear other types of devices that measure respiratory rate, heart rate, blood pressures, to some extent, strain on their body. But the digital technologies around diabetes have become very commonplace, and we're certainly seeing more and more patients across all spectrums wearing these continuous glucometers, collecting that data and asking us to, you know, do we want this data? How do we interpret this data? How do we understand the data that's coming in? So we're seeing more patients with lots of digital health tools across lots of different age groups, ethnicities, and disease states. But it's outside of the cell phone, there's definitely is still significant disparities.
A fair point. Nasser, coming from industry, and I think you've already alluded to the fact that corporations don't really like to talk or share. But in the industry you're in, and cancer care and those types of things, what do you see? What does the future hold in terms of using these technologies for advancing these types of care?
Look, I think a future is bright. I think I'm very optimistic. But the brutal fact is that the issue of healthcare disparities is real, right? Today, the number of technologies and the pace at which they're coming at us, while as a technologist, it just warms my heart and I'm delighted. But often, they're out of reach for many. We spoke about wearables. Like wearables are not inexpensive. Not everyone can afford them. Even healthcare apps typically come with a subscription fee, which is again at times just not, in reach for many folks. Just the issue of literacy is much more in underserved communities. I'll give you an example of cancer care screening. Right, we have tens of millions of folks in this country that are eligible for colorectal cancer screening, but only a portion of them get colonoscopies, and some of them get Cologuard or other tests that are in the guideline. There is a very large number, and especially from data we know in underserved communities, there's a huge gap in just screening. Now, with digital technology, the reach has improved. And as Matt said, look, everyone has a phone. And one of the most, I think, potent ways to reach people is text messages, right? And we see that data tells us that, like, text messages is really effective when it comes from the right person to the right patient and so forth. So there is promise. But right now, one of the concern, I think, for many, including myself, is that technology is making the wealthy healthy, and then there is a large segment of population that, at least today, is not benefiting from all these advances in technology. Now, in the future, I do believe that the cost of technology is going to go down. I don't know when that's going to be. That's probably going to be over a period of some years. But today, I think as a society, we need concerted effort to ensure that all this amazing advances, especially post-COVID, that have happened in adoption, and especially in the last 2 years with AI and Gen AI, the future that at least many of us believe is really bright. It's available for everyone and not just those who can afford it.
Yeah, thank you. Oh, sorry, Matt.
Jeff, can I just jump in for 1 second, just because Nassar brought up colon cancer, and for those not for during the discussion, but Montefiore Einstein, their Comprehensive Cancer Center, along with several other organizations, utilized an AI tool called My Eleanor, which essentially was an AI bot that reached out to individuals across primarily the Bronx community, which is highly diverse, for those individuals that faced higher colon cancer risks and had missed an appointment for a colonoscopy, either had canceled it or no-showed. And so if you search the My Eleanor and read that literature that was generated by Montefiore Einstein, I think you'll find an example of a very positive and potential future for AI and tools that many people have today. So it's a great story and worth investigating on your free time.
Thank you so much for sharing that. We've heard from our panelists on digital health interventions. Let's throw out a poll to hear from you who are participating on what role you see digital health in resolving health disparities. Quite interesting. access to care, improved access to care, and early detection are in the lead. Excellent. Let's pivot a little bit. I think in all our conversations, we've talked about AI. We've mentioned my Eleanor was how we concluded the last segment, and we've heard of different tools. I will start off with perhaps maybe the silliest question, but yes, the most pertinent. What is AI? And Nassar, maybe I'll start with you on that.
But I think so. First of all, there are many definitions, at least from a layman perspective, or people who are not necessarily computer scientists about AI. I've seen it, across the board from advanced analytics to not even advanced analytics. Of course, it's been a buzzword, right? Especially from a marketing perspective. But look, we have been using things like machine learning for quite some time. But AI is the ability, in my mind, to mimic human intelligence, right? So in some way, using technology to mimic human intelligence. That, I think, is the simplest definition without going into neural networks or deep learning or machine learning.
Got it. And thank you for setting that bar. So mimicking human intelligence and hopefully surpassing, if you will, human intelligence where appropriate. We'll go to ethics in a minute after that. But if we stick to that concept of mimicking human intelligence, or at least being able to help humans or accomplish tasks. Matthew, you gave a good example with my Eleanor. Are these tools more hype than they are real? What are you seeing as a practicing physician?
No, the tools are real. The challenge I think we see today with whether you want to call it artificial intelligence or what's becoming the more favorite word in medicine was what we'll call augmentive intelligence or assistive intelligence. The tools are real. AI, like any other field of mathematics, is wide and varied, right? So whether you're talking about the deep neural networks, machine learning, ambient, generative, I think the challenge that we have today in artificial intelligence is that essentially we live in the narrow AI use case bucket still, right? And so, yes, there are lots of artificial intelligence tools, using the very liberal definition of artificial intelligence, that can improve healthcare processes. But these are what I think where we need to get to is we need artificial intelligence platforms. Geeta mentioned it early on, right? Nizar certainly understands it. The need for data for many of these tools is intensive, right? The power they consume, that's a whole nother story. But the data that they need is intensive and significant. They often need to be fed with data in a near what we'll call with high frequencies, so the velocity, the veracity of the data, they're all significant. And what we're putting in today typically solves one use case. And that's not really a sustainable future, right? I can't connect APIs to endpoints every time there's a single use case, right? There's not enough time in the world or money in a health system to build out every use case. And certainly we know that there's no shortage of use cases. So the tools are real. The technology is increasing. It's increasing at a pace that I don't know yet if it equates to Moore's law in the artificial intelligence world, but it probably will, right? And so we're going to need to find better ways to evaluate, select, and implement artificial intelligence platforms within healthcare systems if we're really going to get the benefit of this new, I won't call it sources of knowledge, it's information right now, right? There's data, information, knowledge, and wisdom. Let's hope that the physicians and the caregivers in the healthcare world still maintain the wisdom, right? But we need better platforms in healthcare for AI to really become, I think, the assistive tool that many of us believe it can be.
And Geeta, what AI tools are you seeing or and without naming vendors, just types of tools that you're seeing that seem to be impacting care?
Yeah, so we're actually doing a lot of pilots right now with wearables. And they are making a huge impact because they can really a lot of the times we've been talking about data and data analytics, but a lot of the times it's not real-time intelligence. And so you sort of acting after the fact. I mean, it's hard to sort of put it together to get that clear picture. But what wearables will do is it gives you that real-time intelligence. And we've seen in certain circumstances that we've been able to increase our rapid response teams, for instance, and deploy them very early on. And I'm happy to give you an example. We had a 36-year-old who was admitted with pneumonia. And because the wearables were actually monitoring the temperature and the respiratory rate and the heart rate, etc., it was able to predict that something was going on with this patient. And sure enough, a rapid response was initiated. The patient was transferred to a higher level of care and had to go on high flow oxygen. We had another gentleman who was 76 years old, came in with an irregular heartbeat. Just by monitoring in real time, even though, nurses were doing vital signs every 4 hours, say, or maybe even 2 hours, it caught in between that window of when we would typically do a vital signs that something was going wrong with this patient. We did a rapid response, discharge home with services, everything. Without that sort of real-time intelligence and those variables, we would not have known that. I mean, we're also seeing it in things that's coming down the pipe. So there's a lot of pilots with certain healthcare systems that they actually using ambient documentation. So we know that documentation burden is a huge thing for physicians and nurses in particular. And in some statistics, nationally, they say it can take a nurse, for instance, 35% of a 12-hour shift to actually do documentation, right? AI should be as smart as it needs to be, that I can walk into a room, I can have my smartphone, my hospital issued smartphone turned on, explain that to the patient. And as I'm assessing that patient or I'm interacting with that patient, it should actually be able to translate what I'm doing into real-time documentation. And I see that's the beauty of where AI is going to do, really that augmentative that you just spoke about, Matthew, and that assistive to really make us more efficient and to really also get sort of that real-time intelligence so we can really treat patients earlier on. We can be preventative, but we could also increase our efficiency as doctors and nurses taking care of patients.
Yeah, ambient will certainly, it's almost commoditized today.
Yeah.
Right. From a technology standpoint, it'll be commonplace in healthcare. We expect it to, as we roll this out, to return anywhere up to 5 to 10 minutes per physician per patient encounter. Right. So that we're very bullish on ambient. And I think that ambient for nursing, a different set of challenges, right, with structured versus unstructured data and how you currently construct or add data into your EMR a little more, will require more touch points on technical end to make that successful. But certainly should be, as if anybody who's worked with any of the large language models, generative AI tools today can understand. So I agree with that. Very bullish on ambient and generative in healthcare over the next 5 years.
Yeah, and the good thing is that costs are going down in this area, at least with some of the new, because for a long time, I think that was, this technology was there. It was probably not as perfect as it is right now, but cost was a huge barrier. And I'm really pleased to see that in this one area, at least costs are already going down, and hopefully they'll continue to go down.
Yeah, and I'm going to add to that. I will give you just one more example where we're able to save because of AI. So we know we have quite a lot of vendors out there that are actually they have computer vision. So when you have a camera in the room, the camera is not just your typical camera that's a pan tilt zoom or a PTZ with like a 30x optical zoom. It actually has a dual camera, maybe on one device. One is for the human eye, so I can see you, you can see me, patient to clinician. The other one is computer vision. To me, I feel as though in the very near future, if we can afford this, we should blanket every patient room, every clinic with computer vision, because it is that powerful. And one example of that is at one of our hospitals, we actually deployed ambient using computer vision without the human in the loop. So we want to address the why if it was we were having falls, a lot of falls, and it was very, very expensive to get that sort of one-to-one, right? One aide to one patient. I mean, we have a pipeline issue. So we deploy this technology and we actually remove the human from the loop. And so now, after training for about 7 days, computer vision can learn the room, can learn the equipment in the room, with certain prompts from EMRs and certain APIs that were built in. It can now alert and alarm us when a patient is going to have a fall just by positioning. If we say no rails should be up and it senses a rail down, it alerts you. And that has been extremely significant. I think that's just the tip of the iceberg.
Excellent. I knew we'll get the team passionate once we went the AI route. So that's a good way to get us close towards the end. Now, I'm going to give each one of you. There's many buzzwords that have been used, and I'm not sure everyone understands ambient technologies or computer vision, but folks, Google's going to be your friend for most of that for now. But what I would like to ask is, from each of your vantage points, what technology, digital tools, AI or otherwise, would you say you're most excited for over the next 2 to 3 years? And maybe Dr. Shafiroff, I'll start with you.
2 to 3 years is probably not far enough into the future, but I think what Geeta actually already sort of stole my thunder on it. The wearables, I think, are really going to improve care, especially in hospital-based care. Less so, but probably also in ambulatory based care. But in a hospital-based setting, a wearable not just frees up a lot of time for our teams, but also provides us with the data necessary to ensure that our patients are improving and not getting worse. So sorry to be, not to have a novel answer there, but I do see wearables as really a significant improvement in the hospital. If you want to give me a 10-year frame, I'll even say on the ambulatory side, it's going to be, I'd love to see implantables, because I think that the monitoring of your own personal health data can go a long way towards wellness and consistent monitoring of what is probably will be in the future a sort of a data set for health and wellness instead of traditional sickness and sickness care. But I've seen some implantable technology that I think it may be a little futuristic now, but in 10 years could be something that where individuals are doing to improve their health on a regular basis.
Okay, thank you for sharing that. Nassar?
Look, in the short term, I think, I think we are all excited about generative AI, and like things like ChatGPT and such are amazing. I think it has improved productivity quite a bit, but I think the real use cases are just about starting to come. Meaning adding proprietary data or PHI to generative AI, a large language model tools to get to insights that typically historically would have taken much longer time, and in some cases just impossible as well. And I'll give you one example of a tool that our team developed to help genetic counselors. So they're genetic counselors who have to go through these amazing number of research paper to figure out different mutations and to figure out like what disease is impacted. It's a very laborious process. And with making these research paper available on top of LLMs with some addition of our proprietary data, these things are now at fingertips, like literally strokes away. things that would take in the past like many hours of work and sometimes days of work and research are already, you just type in the right question and boom, there's an answer. It's not always the perfect answer, but it is pretty good. At least that's what our pilots and researchers trying. I think in the short term we are going to see, we're already seeing it first of all, but I think we're going to continue to see explosion of use cases where just the ability to talk, because if you layer on voice on top of chat GPT, again, this is amazing. Just to ask and the question that in the past would have taken much longer. And again, I'm talking about in the context of data that is today in closed databases. So all LLMs are already available. We can do that today. But now I think going forward, how do we marry the data that is locked in our databases? And that work's already happening as well. But I think we are going to see an explosion, and it's going to be across different disciplines.
Gotcha. Thanks for sharing that. Would you bring us home on that topic? What are you saying?
Yeah, I'd like to expand that out just a little bit to say that, when we look at the WHO definition, it tells us that only 20% of the presence of disease and access to healthcare is about health. The rest are like 80% that we're calling social determinants of health. And we know that healthcare does not exist in a vacuum. And we're at the point where we're moving from digital transformation to, I would say, digital evolution, because it's moving so quickly. And whatever is happening out there with digital evolution, because healthcare does not exist in a vacuum, will impact us at the bedside. It has to flow down, right? So I think that as that's happening, I would just want to say that as we adopt digital health services, I hope it will always be led by clinical care needs versus the technology itself. And that is something that I just sort of want to call out because it's sort of top of mind that we really don't use that empathy that's in healthcare. But if I look to the future, I would say that like Matthew said, wearables to me has huge potential, especially as we have almost 90% of our gross domestic product that is being spent on healthcare is about chronic disease and mental health. And we have a real opportunity to help our patients self-monitor and to get that information to us and prevent that sort of loop of always coming back for readmissions, etc., but also to engage them in preventative care. So that's huge. And I think that's also important because of the move to from brick and mortar to really the communities where our customers and our patients live and work. We really need to do that. The other thing that I think is really big is we all talked about data and really being able to drill down on that data to really provide precision care for patients. I think precision care is going to be big. And I think with all the developments that are happening right now in quantum computing, and we can crunch data a lot more quickly, and then we can use AI to help us interpret that. I think that's going to be huge. But I also feel I want to call out virtual care because virtual care is really going to, we talk about care maybe in 10 years from now, the same way we're saying digital, we just call it digital, we don't say digital care. I think virtual will be the same thing. Whether I am being cared for by an in-person clinician or I'm being cared for remotely, I think it's just going to be care. And I think it's going to continue to grow as we look at the trend with the growth in ambulatory care. So I think those three things are going to be the most impactful in the short term. But I want to agree with Sam Altman here when he says that we got to watch AI, because if we make the leap from AI to artificial general intelligence and then artificial super intelligence, it means we're going to be stuck in this recursive loop where basically the machines that we have will make the future generations of machines smarter. And I think we're going to see the sort of that exponential growth in digital health services.
So Gita, you just gave me flashbacks from some of my favorite movies,
Yes,
Terminator, Judgment Day. And first of all, I'd like to thank all the panelists. There's a couple of, want to give some time for some questions from the audience. And there's one that's on there, which I was going to lean into, which is really good. We've talked about digital, we've talked about sharing, we've talked about potential with AI and consumption of data. one thing we haven't touched on, which is the question that's in the chat, is really about privacy and security. And effectively consumer confidence in privacy and security. So even if we have the most secure systems in the world, would you trust it? Why should you trust it? I'll open it up and just say anyone who wants to take a first pass, just feel free to jump in.
It takes time. There were people who said that you couldn't do digital banking to go into a bank anymore. Right. Yes, we are all bound to protect and secure data, and those tools are advancing. I know at our organization and in our health system, the commitment to cybersecurity and data protection is significant, both just in culture, not just in culture, or perhaps more importantly in culture, but also financially and through personnel. So we take this very seriously. We believe it's our responsibility to protect data, but to some extent, and I think we saw that from the answer in the questionnaire, right? The liquidity and the exchange of information is also an expectation. So we have to figure out how to balance those two opposite sides of the seesaw. But for those people who say that it can't be done or it won't be done or people won't share their data, well, the same thing was said about banks 25 years ago, that people will never do digital banking. And I don't know the last time we wrote a check in our household.
Fair enough. Anyone want to jump in?
Yeah, I want to add to that. I think we can all appreciate that there's a dark side to this, right? And that there are multiple conversations we know happening around the world, exploring privacy, trust, data breaches, bad actors, bias, and misinformation. People are worried about displacement of jobs. But then I agree with Matthew. I mean, 250 years ago, when we had our first industrial revolution, nobody believed we would be driving cars. We thought we would never get rid of horses and carts. Nobody believed we would go to the moon, and the stuff that was once science fiction is now becoming novel and then mainstream. So I think it will all depend on the rate of adoption. So we have our early adopters and we have our late adopters. And I also feel it's inevitable. It's inevitable. We can't stop it. I think the genie's out of the bottle, the wolf is at the door, whatever analogy you want to make, it's kind of like out of our hands. We just got to contain the beast.
Yeah. Look, I think I agree 100%. Look, first of all, I don't think that this is going to stop, number one, but the concerns about privacy and cybersecurity are real. AI is very data hungry. And the question is, where is this data set coming from? And my concern is that patients don't know how their data is being used, because the regulations are outdated. Regulations today, even when we think about HIPAA, that was written like many years ago, 20 years ago, and other regulations are simply not sufficient today. Patients don't know how their data is being used, and companies, third-party vendors are just doing everything in their power to get their hands on all sorts of data. That's how this thing works. And even when I think consumers know and they don't have a choice. I don't think consumers have a choice. It's very hard to say, no, don't share my data. It's impossible to say that in most cases, and that I think is a concern. And I think that US is perhaps even behind in terms of taking action. I think some of the other countries have done a better job, but I think everyone is behind. And I think it's just the nature of societies. I mean, technology is running at one pace, and everyone is at a different pace, which is much slower than, in this case, AI.
Got it. Okay, let me check the chat, see if there's any other questions. Okay, so there's a comment there. And I think the question there, if you can see it, is, does anyone ever read end user agreements or any of the user things? And I will laugh and say, I'll give an example for myself. I remember once I had turned on, I'm a big Android user, so I turned on Google Maps, and you have it and you go places. And all of a sudden, I didn't realize that I had accepted that to be in this trial where it could predict where you're going. So one day I wake up in the morning, I normally wake up at 6:30, get my car. 6 a.m., my phone pops up and says, there's traffic on the FDR. And I'm like, why? How? I was freaked out. The first time I was really nervous. The second time, actually, I appreciated it when it came up. I was like, okay, now there's an alternative route before I had even searched. So I think the very crazy thing that's going on with a lot of these technologies, they're making the utility of the technology so valuable that we give up the initial privacy concern. And I think that's going to be a challenge. And I think Nasser's point about the regs catching up, and of course us being vigilant to the extent that we can be, and as healthcare institutions being custodians of health data to the best of our ability is going to be key. Okay, I don't see any other questions. Carl Marie, do we have any other questions that have come through that we should?
I think that we covered most of them here.
Okay.
Overall.
Thank you. So the one thing I'll do before we get into closing, I think Darren is going to make a few statements before Tia. None of us thought we'll get to 8 p.m. Great job to the panelists. You guys have been absolutely fantastic. Truly humbled to share the panel with each and every one of you and watch you guys share your talents. And to those of you who've listened to us, thank you so much. With that, Darren, you want to just bring it home for us?
Well, thank you. Good evening, Hilny members and beyond. My name is Darren Daraj, and I'm your President-elect for Healthcare Leaders of New York. What an incredible panel. Thank you, Chif, Matthew, Geeta, and Nazir for such a lively conversation about digital health. And the fact that the wolf is at our door with AI and so many more things coming up related to technology, patient experiences, workforce ability, and so much more that is aligned to technology and digital health. So thank you again to the amazing panel. Next slide. Please join us for additional and continued incredible discussions, educational activity, and networking opportunity at our upcoming events. We have our Equity of Care in-person event at Hofstra University on October 30th. We have a community service walk that you can participate on November 10th. We have another virtual event focusing on post-acute care November 12th. And then our annual Frank Camerano Memorial Dinner and Lecture at St. John's University on November 19th. And to bring us home at the end of the year to introduce and induct our new executive board, join us at Terrace on the Park December 3rd for our holiday party. We look forward to seeing you all at our upcoming events in terms of our fellowship and continuing to add value back for our wonderful members and beyond. Nothing that we do in Healthcare Leaders of New York is possible without the contribution, partnership, and support of our sponsors. So thank you so much to our incredible sponsors for Healthcare Leaders of New York. Before we close, I'm going to hand it off to Tia, who is a representative of the American College of Healthcare Executives, to speak on the closing of this event. Once again, thank you to our incredible panelists, moderator, and to all of you. Tia, take it away. Thank you.
On behalf of ACHE, I want to thank our chapter leaders that planned today's session, our moderator and panelists, and all of you for your participation. Please complete the evaluation, which is open for 1 week. I have shared the link in the chat box. You can also access the evaluation by visiting your My ACHE page and selecting My Online Learning from the helpful link section on the right side of the screen. From there, click on the Access My Courses link, and you will be directed to our learning management system where you can complete the evaluation. In the same location, you will be able to access the recording of this session within approximately 2 business days. Everyone who attended today's event in its entirety will see their 1.5 hours of virtual interactive education credit posted to their My ACHE account within 2 weeks of this session in the My Education Credit section. That concludes our event, which is copyrighted in 2024 by the American College of Healthcare Executives. All rights reserved. Thank you, everyone, and have a fantastic evening.
Here.